wellness revolution starts now.
Welcome to the program. My name is Bryana Gregory, pharmacist and physician liaison with Physicians Preference Pharmacy. Today, we are going to be discussing a very crucial part of our day every day. We're going to talk about sleep. Now, we probably don't have to go very far to find someone, or maybe even you included, saying that you don't get enough sleep. You're not alone, that's for sure. The question is, what can we do about it? We're always trying to take a root cause approach to why we have symptoms, and that's partially what we're going to unpack today. And then, of course, we're going to discuss some solutions. So I'm really going to be focusing on the benefits of melatonin, but far beyond what you're probably already familiar with. So more than 1/3 of adults actually sleep less than 7 hours a night. We usually try to aim for hitting those 8 hours of rest, but we know that we usually fall short. And also, our sleep requirements change as we age. As we're growing, as we're kiddos, we need more sleep. As we get older, we tend to require less sleep. And then we kind of fall off the shape of the bell curve and seem to require more sleep as we age. So I want to start out with a few sleep statistics to put some things in perspective here for us. So in a normal sleep period, when you lay your head down to rest in the evening time until you wake up in the morning, a person experiences generally 4 to 6 sleep cycles. So a lot of people have these wearable rings, such as the Oura Ring or something else like this, apps that measure their sleep. So you can see the fluctuation. It's really important that we have these consistent and multiple sleep cycles to be sure that we're hitting our marks and making our hormones, making growth hormone, making testosterone. A lot of things happen that are crucial to hormone balance and balancing the endocrine system and the metabolic system that actually stems from sleep. So we should not be ignoring this. More than half, about 54% of adults, identify that stress and anxiety were the top reasons that they had trouble falling asleep. Now, this is an important differentiation. When we have trouble falling asleep versus staying asleep, or both, we need to address those a little bit differently. 95% of adults lose at least an hour of sleep to pain every single night. Also, sleep disorders affect up to 60% of post-menopausal women. So whenever we see a drastic fluctuation in how often a symptom is showing up pre or post a major metabolic change, a major hormonal change in our life, this could be puberty, this can be pregnancy, this can be menopause, we need to understand the connection there. Again, we're always thinking through a root cause lens. So we know that hormones are directly related to sleep, and also that getting appropriate sleep is important for making appropriate hormones. One study estimates that an annual cost of workplace errors and accidents linked to insomnia equates to about $31.1 billion. So for business owners, this is really important. It's important to know that your employees are getting restful sleep, but also what they do during the day, their workplace environment also affects their sleep at night. And this is where we have a conversation about light and stimulation. You hear about people wearing blue blocking glasses. The reason that that is happening is to keep out some of this overstimulating light, but also the natural red light that we would usually get when the sun rises, for example. People use red light panels to mimic these things or mimic these cycles. So what can we do about it? As a pharmacist, of course, I want to bring to you one of our compounded prescription options. But again, if we're going to use something like melatonin, which is what we're going to discuss today, we want to know that that's actually part of the root cause issue. So lifestyle cannot be ignored. But let's unpack melatonin. Melatonin is a hormone produced by the pineal gland, which is located in the center of the brain. So your body is naturally making and releasing melatonin from that pineal gland frequently throughout the day. Of course, you've heard of the term circadian rhythm. And so melatonin production and melatonin release have a lot to do with the regulation of this circadian rhythm. Let's remember that from our waking moments until we lay our head down on the pillow at night, we are experiencing a series of cycles and stimuli that affect not just our daily routines, but our body's ability to prepare for sleep and to successfully sleep. So that circadian rhythm is not just about sleep, it's about how we perceive, again, the light in our environment throughout the day, the stimulation in our environment throughout the day, and how that impacts our ability to fall asleep several hours later. So we cannot discount what we're doing during the day to address good, healthy sleep. So melatonin is actually a hormone, as I mentioned, and it is very important in helping to actually allow the body to manage oxidative stress. It is important because it connects the functionality of the nervous system, the endocrine system, the reproductive system, and the immune system. So we already know that if we don't get enough sleep, we will get sick. This is the direct link with the immune system there. Now, elevated evening melatonin levels, which is what we want as we get closer towards bed, we want those melatonin levels to rise because as melatonin is made, and we make it when we are signaled by darkness around us, then it helps to manage that circadian rhythm, to pump out melatonin, which flows throughout the body and hits those target organs, telling the body, okay, it's good, it's time to power down now, it's time to rest and fall asleep. But melatonin is also a master antioxidant. So the higher levels of melatonin that we have, the more protection against autoimmune conditions, inflammation, and cancer we will be provided. So melatonin is also known as something called a chronobiotic. So chrono meaning time. We're thinking about, again, that circadian rhythm and the fluctuation and production of melatonin throughout the day. So if we walk outside and we wear sunglasses, we are cutting off the body's ability to understand that we are not supposed to be making melatonin. So if we're wearing sunglasses, it's telling the body, it's telling the brain that it's dark. By doing that, we will increase melatonin production and we will have less of that light that is taken into the eyes, providing that natural signal to be alert and awake during the daytime hours. So wearing sunglasses can be a bit controversial. It does tend to skew vitamin D and melatonin production, which are both really important for balancing the immune system. Now, melatonin, being a hormone, naturally decreases in production with age, just like a lot of hormones do. That's natural. In fact, reduced melatonin levels are also found in chronic conditions like dementia, mood disorders, severe pain, cancer, type 2 diabetes. But it's important to note that these are not necessarily causation, but more so correlation. However, if we can balance our melatonin levels starting at an earlier age, we are less likely to probably develop some of those chronic conditions going forward. Now, dysregulation of melatonin itself or melatonin production in the body is associated with sleep dysregulation. So one of our options is to replace it, just like we do with other hormones, whether that's estrogen or progesterone or testosterone. As our production decreases with age, we can come in and support it or replace it with compounded hormones. And we do that with melatonin as well. One of the places that this can get a little bit tricky is for those people that work night shift jobs or travel very frequently in between time zones, especially if you're suffering from jet lag. However, we know that melatonin is actually a treatment for jet lag. So depending on what your lifestyle is and your career habits, you may need to come in and use melatonin as a tool because what we're trying to do is reset the circadian rhythm. When we have this sleep schedule that is flipped or sleep disorders that cause us to maybe wake when we're to be asleep and sleep when we're to be awake, I do have some guests that have a complete flipped schedule like that. And so they may go to bed at 6 or 7 in the morning, they sleep throughout the day, and they don't even have a night shift job. So this can take several months to get them back on track, but what we're trying to do is reset the circadian rhythm. Melatonin may be one of those options that we use. So 88%, a study has shown 88% of adults who take melatonin say it actually helps them fall asleep faster. So that begs the question, well, what if I don't have trouble falling asleep? What if I fall asleep fine, but then I wake up in the middle of the night? This is where we can get crafty with our compounded options of melatonin. So at Physicians Preference Pharmacy, we compound 2 primary formulations in several different doses. One is an immediate release sublingual tablet, and the other is a sustained release or delayed release oral capsule. Sometimes if we have someone that has trouble falling asleep, we want that immediate benefit, and so we would use an immediate release tablet that dissolves under the tongue and helps to prepare the mind for sleep and reset that circadian rhythm. For those people that don't have trouble falling asleep but wake up in the middle of the night, we want to use a formulation that is sustained or delayed release so that over the course of several hours, it is slowly being released throughout the body, helping to keep your mind in a state of rest rather than wakefulness. And sometimes we have guests that use both. Sometimes life brings on certain situations that calls for support from certain added hormones like melatonin to get us back on track. And sometimes if we have trouble falling asleep and staying asleep, we may actually use a combination of both of those compounded prescriptions. So what about the question of long-term melatonin use? This is a very common question. Well, what if I use it long-term? Is it going to shut down my natural production? Let's remember, we're always having a continual fluctuation of melatonin production throughout the body, and a lot of that is driven primarily by light signals. So be very cognizant of the way that you block out light or allow light in. Blackout curtains, for example, make the room dark, tells your body to produce melatonin and be in a state of restfulness and sleepfulness. Also, if we're going outside a lot in the light and the sun, it could be beneficial to allow that natural light in rather than wearing sunglasses so that your body is not confused about when to stay awake and when to fall asleep. Additionally, if you do have an indoor job, you're not going to have that natural light again, giving you that consistent signal that you should be awake during these awake hours when you're supposed to be productive at work. So when we use melatonin long term, research shows that long-term administration has found to produce no difference between exogenous melatonin, meaning something we would take in through a prescription, and placebo, or taking nothing. So, and the long-term effects and the negative effects between the two. So we don't see any actual evidence that taking melatonin consistently decreases your natural production. Again, remember, there are plenty of factors that are impacting melatonin production in the body. In fact, long-term usage appears to even benefit certain patient populations, such as those with autism spectrum disorder, and that comes straight from the literature. Additionally, as a pharmacist, I'm always concerned about not just the efficacy, but the safety. There is something in clinical trials that are done on animals that we call an LD50. That is a lethal dose 50, which means what dose of said drug, whatever drug is being studied, needs to be given to kill half of the animals in the study. That's an LD50, and that's common practice. That being said, what is shocking about melatonin is that it has an LD50 of infinity, which means it cannot kill an animal. So it's highly safe, and it is standard practice to use the data from these animal studies and extrapolate it into humans before we test it in humans. Something else I want to point out is that oftentimes when we think about getting melatonin, we may think about going down to the corner store and just picking up a bottle of melatonin. Although melatonin does seem to be beneficial for many, in an unregulated setting like that, it's hard to know, especially if certain supplement companies lack extensive testing, that what it says the strength is on the outside of the bottle is what you're actually getting. Some studies have shown that over-the-counter melatonin products can contain up to 347% of what they are labeled on the outside. So that's just one reason why you may go for a compounded prescription that is tested and potency verified. As far as dosing goes, most folks can get away with taking somewhere between 1 and 3 milligrams of melatonin every single day, whether this is in the oral capsule form or even in the sublingual tablet form. So it's completely customized with, again, a high safety profile, which gives you, as the person taking melatonin, the opportunity to add a little bit more or back off depending on your current needs at that time. So if you have any questions about our compounded formulations of melatonin at Physician's Preference Pharmacy, please feel free to reach out to us and speak with any of our pharmacists. You can reach us at 281-828-9088, and it would be our privilege to serve you. At Physician's Preference Pharmacy, we understand that the quality of your compounded medications directly affects the way you feel, which is why we believe that your pharmacy should specialize in compounding medications while also delivering extraordinary hospitality and guest service. We believe that both patients and prescribers should accept nothing less than consistency and quality from their compounding pharmacy. This is why we've implemented some of the strictest quality standards in compounding, exceeding standard requirements, achieving PCAB accreditation, which is the Pharmacy Compounding Accreditation Board, an organization that sets the highest standards in compounding pharmacy regarding the safety, cleanliness, and quality of your compounded prescriptions. Because of our commitment to complete health and wellness, we are dedicated to making your medications free of lactose, parabens, artificial sweeteners, and any unnecessary dyes, binders, or fillers present in many other medications, offering you the cleanest products possible.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.